Bismillahirrahmanirrahim. Assalamu alaikum. Today, in this lecture, I will discuss some of the examples or some of the types of the anemias. Mainly, the difference lies between the cause of the anemia. It may be blood loss anemia, aplastic anemia, megaloblastic anemia, hemolytic anemia. So, now onward, I will discuss one by one in detail. Number one is the blood loss anemia. After acute hemorrhage, fluid plasma is replaced in 1 to 3 days. But RBC concentration usually returns to normal within 3 to 6 weeks. This type of the anemia, it may be due to the acute hemorrhage or may be due to chronic hemorrhage. If there is chronic hemorrhage, a person frequently cannot absorb enough iron from the intestine as rapidly as it is lost. And RBC that are much smaller than normal in this type of anemia and have the appearance of microcytic hypochromic, that is smaller than normal and the coloration is lighter than normal. The next thing is aplastic anemia. As its name shows that in this type of the anemia we have the defective functioning of bone marrow. It may be primary or secondary, and primary may be congenital and acquired, and secondary may be due to ionizing radiations, chemical drugs or viruses. Secondary means that the initial or primary cause is something else and it is causing or leading to the disease, that is aplastic anemia. So due to different types of the chemicals, drugs, viruses, initially that is the initial or primary cause and it is going to affect the bone marrow that cause the aplastic anemia. Bone marrow aplasia means lack of functioning bone marrow. It may be congenital and acquired, as I have told you, and may be due to the high dose of radiation, drugs, certain toxic chemicals, or maybe the autoimmune disorders. From this picture, I am telling you the difference between the normal bone marrow picture, acute leukemia, and aplastic bone marrow. So you can clearly differentiate between the normal functioning bone marrow as compared to the abnormal functioning aplastic bone marrow. Different types of the nutrition deficiencies, they can also lead to the anemia. Different types of the deficiencies like iron deficiency, vitamin B12, folic acid or intrinsic factor deficiency, all they can cause anemia. RBC grow too large with odd, bizarre shapes and have fragile membranes and are called megaloblastic. Mega means large and blast that is the bigger than or larger than the normal. These cells rupture easily, leaving the person in direct need of an adequate number of RBC. So, the cells can rupture easily, leaving the person in dire need of an adequate number of RBC, which can lead to the anemia. The first thing is the megaloblastic anemia. Slow reproduction of erythroblasts due to the vitamin B12 or folic acid deficiency leads to the larger size of the RBC. In these RBC, defective DNA synthesis maturation failure occur because of the deficiency of vitamin B12 or the folic acid. This deficiency of vitamin B12, it may be due to the nutritional deficiency as the person is purely vegetarian, or any malabsorption syndrome, that is defective absorption, intestinal absorption is not proper, so that, and it may be due to the lack of intrinsic factor which is very much necessary for the absorption of vitamin B12, leading to the pernicious anemia due to the intrinsic factor deficiency in patients with autoimmune atrophic gastritis. Or it may be due to total or partial gastrectomy. Gastrectomy is the surgical operation related to the stomach. So either the total or partial gastrectomy means that either the total or whole of the stomach or some of the part of the stomach that is surgically removed due to the disease process. Or it may be due to the small intestinal lesions. Through this slide, I am telling you or comparing the size of the normal RBC with the megaloblastic cells. You can see these are the larger than the normal RBC's cells. These are the, and also hypochromic. The next is the hemolytic anemia, which may be hereditary or acquired, congenital or acquired. Acquired means after birth, congenital that is at birth, from early from birth. So it may be hereditary or acquired. For example, spherocytosis, any metabolism is defective. For example, glucose 6-phosphate dehydrogenase deficiency or hemoglobin or immune infectious diseases, drugs like that one. Hereditary acquired abnormalities of RBCs make cells fragile, so they rupture easily as they pass through the capillaries, especially through the spleen. So in this type of the anemia, the RBC shape that is different, and it may injure the blood vessel while passing through it. The common example is hereditary spherocytosis, sickle cell anemia, erythroblastosis fetalis, and thalassemia. In first type of the anemia, hereditary spherocytosis, the RBC are very small and spherical and do not have the normal loose bag-like cell membrane structure of biconcave disc. What happened then? They cannot withstand compression forces, and passing through the splenic pulp, some other tight vascular beds, they are easily ruptured by even slight compression. So you can compare the normal RBC with the spherocyte-shaped RBC while passing through the blood vessel. This is the abnormal shaped RBC. Sickle cell anemia, as its name shows, that we have some S-shaped involvement. So the hemoglobin is S-type containing faulty beta chains. That's why hemoglobin is S-shaped or S simply. Because of that, we have sickle cell anemia. And the basic fault is the basically faulty beta chains. The amino acid valine is substituted for glutamic acid at position 6 in each of the two beta chains. So, because of this abnormal hemoglobin shape, because of abnormal beta chains, the hemoglobin becomes abnormal and it leads to the sickle cell anemia. These crystals cannot pass through small capillaries and may injure the blood vessel wall. You can see spike-like or needle-like structure of this abnormal type of the RBC. Normal disc-like shape, you can see this one, while the needle-like or the spikes-like structure, they can injure the different blood vessels. Erythroblastosis fetalis, we will discuss this topic later on also in much more detail. But here I am just giving you an idea about that it may have the anemia also. So in erythroblastosis fetalis, which is a newborn disease, and the defect lies in the Rh incompatibility. Rh positive RBC in the fetus are attacked by antibodies from an Rh negative mother. So the baby have erythroblastosis fetalis, and you can see clearly the different types of the abnormal shaped RBC in different types of the anemia. Microcytic, the size is smaller and color is lighter. Megaloblastic, the size is larger. Here the sickle shaped RBC, needle-like shape, and here we have the erythroblastosis fetalis, in which we have the abnormal Rh incompatibility. Thalassemia, that are genetic blood disorders that can result in abnormal formation of hemoglobin chains. There is mild to severe anemia depending upon whether it is homozygous or heterozygous. Alpha thalassemia maybe or maybe beta thalassemia. Coming to the next thing, that is the polycythemia. Poly means excessive, and the word this emia, this one, the last one, this, it is specific for blood. So anything ending on this one like anemia, polycythemia, they shows that this is related to the blood. How we define it? Polycythemia, that is an increase in the hemoglobin concentration. It is opposite to the anemia, in which we have decrease. Here poly means much more. So an increase in the hemoglobin concentration above the upper limit of the normal level. For the patient's age and sex, again age, sex, environment, nutrition, deficiency, all these factors, they are affecting the hemoglobin concentration, but this time it is increase in the hemoglobin concentration. Polycythemia may be primary or secondary, and primary is polycythemia vera or erythemia. Secondary polycythemia is abnormal quantities of RBCs, they are present, and the other category polycythemia vera, genetic aberration that are present. Effects on the circulatory system that will be studied later on. Polycythemia absolute or relative. Absolute is increase red cell mass, relative normal red cell mass, but it is diluted so that, or it is concentrated so that it is not remains normal count. In the absolute, we have the primary polycythemia vera or secondary, and relative at that time the plasma volume is lesser. So the volume in which the RBC they are present, that is relatively lesser in amount, and because of that they become much more. So we can say it that the normal red cell count is there, but it is relatively higher as the blood plasma volume that decreases. Absolute polycythemia, that is secondary, may be compensatory or inappropriate, and may be physiological or pathological, and I have already told you what is the difference between the physiological and pathological. Again, the physiological is at high altitude, and but the pathological, that is maybe due to the cardiac or pulmonary or any other specific disease. Inappropriate erythropoietin increase, it may be due to the tumor secreting erythropoietin. Hemodynamic effects of the polycythemia includes increased viscosity, which leads to the sluggish blood flow. Increased blood volume, increased venous return, hypertension in 1/3 of the patients. All these, they are not present in one patient if there is relatively excessive RBC while the blood volume is lesser, then it is relatively high. So in that case, the blood volume or plasma volume that is lesser in amount, which makes the normal RBC count relatively excessive. So this, you cannot say that all these effects they are present in a single patient. But we should concentrate to this point that if the viscosity is increased, that is the relative proportion of cellular part and the plasma part that is disturbed, so that viscosity increases, it can lead to the sluggish blood flow. If there is increased blood volume, because of the increased blood volume, even the normal RBC count become lesser, relatively lesser. As the blood volume is increased, it can lead to the increased venous return. Hypertension may be there in one third of the patients. It may be there or it may not be there. Okay, with this we complete our today's lecture. Next time we will study the new topic. Up till that, Allah Hafiz.